Skincare is not one size fits all. At Image, we rely on skincare professionals and clinically proven ingredients to create solutions that adapt to your lifestyle. But don't take it from us. Just ask the 30,000 plus professionals in over 60 countries across the globe who trust Image Skincare to deliver when it comes to results. And while we got our start with Skincare Pros, we think it's about time you got to know us better too. Tune into Skinfluenced to hear straight from industry professionals on how to keep your skin healthy, radiant, and resilient through every stage of your vibrant life.
Hello and welcome back, skincare aficionados, to Skinfluenced, a podcast where we chat all things skin. I am Jacqueline Hill. I am your host, and I'm very excited about today's episode. I hope that you guys got an opportunity to tune into last month where we talked with Dr. Mark Ronard and we really focused on healthy aging. It was one of my favorite podcasts that we've done so far. We talked about everything from mind, body, and spirit. So if you didn't get a chance to listen to that, definitely tune in. But today's topic is really, really near and dear to my heart. Today we are going to be talking about taking action against acne. So from everything from acne positivity to the best treatments, technologies, what kind of food you can eat, how hormones affect acne, how stress affects acne on your skin. So this is really the reason that I got into skincare. So as a professional skincare therapist for 30 years now, I started because I had acne and I could not figure out how to take care of my skin. And so this was part of my skin journey. I said I had acne, but what I want to say is I have acne because it's an ongoing process for me every single day, taking care of it. And we have an expert here today. So our guest here today is Dr. Deborah Longwill. And Dr. Deborah is a board-certified dermatologist. She became board-certified in 1992, and she's bringing her expertise of the very latest treatments that she uses on her patients. She has served the South Florida community for over 30 years. She also lends her expertise in a lot of different things in the medical industry, from mentoring physician's assistants, nurse practitioners, high school students, medical students. And on a personal note, she is a devoted wife of 37 years, the mother of 4, the grandmother of 3, and in her time away from her practice, she enjoys outdoors, photography, yoga, cooking, and celebrating with her friends and family. Dr. Longwill, I feel like you have more hours in the day than I have, or you have some extra hours to be doing all of these things. So welcome. I'm so excited to have you here with us today on the podcast.
Thank you so much for inviting me. It's very exciting to be here.
It's exciting. So this is Dr. Longwill's very first podcast ever. So she blows up and she becomes world famous, you guys will know that she started here with us at Skinfluenced. So let's get right into it. I wanted to talk about this acne positivity movement. Are you aware of this movement that's happening kind of all over social media?
Yes, I am. I'm very excited for it. I have patients that come in and they feel so sad that they have acne, and I feel for them. And now with this positivity movement, they're able to go ahead and feel okay. It's okay to have a pimple, wake up with a pimple, and it's okay not to touch it, and it's okay to feel beautiful all the way around with just having a few blemishes on your face or just little red marks or scars on your face. It's okay. And to feel good, and that's just, the pimples are not you. You are more than that.
I think that's so important. The pimples are not you. So this statistic I thought was really interesting, that 9 to 10 people age 11 to 30 will experience some kind of acne at some point. So that's almost everybody. So it doesn't really make a whole lot of sense to be shaming people for their skin or having breakouts on their skin.
Correct. In my experience, I've seen kids that have acne, and then they become adults, because I've seen them grow up. They have no acne as an adult. And then there's the parents that have never had any acne, and all of a sudden now they're older and they're in their 50s or 60s, and and acne's not going to spare them. They can get that acne rosacea. Yes. So some point in one's life, it appears that you're going to get acne, whether it's in your teenage years, your midlife, or older.
Or you could be like me and you can have it from your teenage years to your midlife and keep it as you're older. And so it could just be something that is part of who you are, and every day you get to do a little maintenance and take care of it. So,
it's chronic, yes.
Yeah, it definitely is chronic. And my dermatologist when I was 13 told me that it would go away when I became an adult. So sometimes I want to find him. Oh. And tell him that did
maybe you just
happen.
haven't grown up exactly, and you're just having a great time being a teenager.
That could be. And maybe he meant mentally grow up, and then that's why it's never quite gone away. So, well, yeah.
Because you look young at heart and all.
Well, thank you. When I read your statistics and I look at you guys, if you could see Dr. Longwill, you would not think she's done anything for 30 years because she is incredibly young looking.
Thank you.
Okay, so let's get into what exactly acne is. I know we have, people think they know what acne is, or, when I was young, I was just thought it was because my face was dirty, right? So the more I would wash my face, my acne would go away. So let's talk about a little bit what it is. First, what causes acne? What exactly causes it?
Well, there's a buildup in the skin that causes like the dead skin cells, and the bacteria can develop inside the hair follicles and your pores. And then you can develop either inflammatory or non-inflammatory acne.
Okay.
So the inflammatory would be more the red pimples, the pustules, the cysts, the nodules. And then you have the non-inflammatory, just those little white bumps that are hard that you just spread I see patients come in all the time, they spread their skin and they say, look, doctor, look, I have all these bumps.
Right.
So, and typically the non-inflammatory, the little clogged pores that people are seeing underneath their skin, their patients just love to pick them.
Oh.
And then they can turn into this inflammatory acne, and all these dead skin cells with bacteria develop, and then you develop worse problems after. So acne can develop with little bumps to an inflammatory with pustules, cysts, nodules, or even an acne pustular cyst, like a combination.
Right.
And then you have you can develop it on your face, your chest, your back, your arms, sometimes the backside.
Right. And is it something that's hereditary? Like, do you get it from your parents? Is it stress? Is it hormones? Is it food? Is it a combination of everything?
Typically, it's a combination of everything you've just said.
Okay.
The hormones when you're a teenager are going like sky high, and you're nervous about all the things that's going on in your life. So your cortisol is going high, and you're not really stable in your hormones. So then that's where the acne gets developed in the cystic. And that's really genetic. So typically, if you're going to see the real indented scarring, that's like a parent or somebody in the family has it.
Okay.
And then you get away with just the little pustules that go away after a week or so, and they only come when you're having your menstrual cycle, or a guy gets it like if he's playing lacrosse and he has like a mask on his face that's rubbing.
Right.
That could be just like a cause. And also food. And sugar and dairy are very common causes of acne, and then which we haven't, I'm sure we'll touch on later.
Those are my two favorite things.
Yeah, the PCOS, the polycystic ovarian syndrome, which where the women are getting a little bit of acne because of the increase in the male androgen or hormones in their system, and that's typically genetic, but also I'm finding it a lot now because of the hormones that are fed are in our chicken and our meat and our eggs and our milk.
And our milk and our cheeses, all of that. It goes kind of across the board.
Yeah, and then when formulas, if you look at the main ingredient in a formula, it's supposedly the most natural form to mother's milk.
Yes.
But the first ingredient is corn or corn sugar or soy. And those sugars, I think... and I'm not saying I haven't done a study or anything, but I think that there's some type of responsibility there for causing a lot of the girls now getting PCOS. And PCOS is not only acting on the acne part, but it's also increasing hair on their face. They're losing hair early on their scalp. They're gaining weight, and they're not able to lose it. And they're exhausted and tired, and then it develops into, or can develop into, like a diabetic situation.
That's so interesting, because I think that's something that we don't think about. You think, well, I ate a healthy form of that, but you don't look at the entire formulation of kind of everything that's in the food that you're consuming. And just one little ingredient can have such a big effect. So those are some of the things that people should look for: dairy and sugar and soy.
And corn.
And corn syrup.
Yeah.
Yes.
Yeah.
Okay.
And then, back in the day, we would have a glass of milk or have a couple of glasses of milk, and it's going to make your bones strong.
Of course.
But we didn't know that this milk was actually making our acne worse.
All right. So those are some really, really good key points. And for my skin therapists who are out there, that might be a really good thing that maybe add to your skin consultation if people are suffering from breakout and acne. So we talked about some of the things that can cause it. First of all, what are some of the treatments? Are the treatments topical? Are there things they can do at home? Do they need to go in and see a skin therapist or come in and have like laser with you or extractions? I like to watch Dr. Pimple Popper.
Oh.
So like, what are some of the things?
Well, first thing is less is more.
Less is more.
So when you start looking at your face in that high-powered mirror and you start noticing pimples after you've brushed your teeth, you're like, and you can't stop and you keep picking, you're making your situation worse. So then you're going to make yourself have scars. So the first thing is less is more. So wash your face with a gentle washcloth with whatever cleanser you like the best that's not overly drying or overly non-cleaning, and dry it well with the washcloth. And if you have pustules and that look like bacterial, typically we, in the dermatology world, we will give you maybe a topical antibiotic,
okay,
or we can give you a topical like anti-androgen, which is like a spironolactone, okay, or we also have benzoyl peroxide, salicylic acid, adaptogens, or retinoids, and all of these in combination help with different forms of acne, with comedonal or the pustular or the cystic.
Okay.
If you have cystic acne consistently, topical is not really going to help you completely. You're
right. And the cystic, those are the big hard ones under the skin, right?
Yes,
that hurt.
That hurt, and you can't. And if you can't swing by the office and get a quick injection to make it go down, we would. And if it's chronic, we would technically give you an oral antibiotic for a short period of time. And if it's really bad, I'm sure that the community knows about Accutane, and Accutane has got a lot of side effects, but it's a great medication if you're a candidate for it.
Yes, and Accutane, that's for the most like severe cases where we've kind of tried everything else, and like this is like our last effort to really get it under control.
Also, like if you have pustular or cystic acne that's causing keloids on the back or preventing future scarring, it's a really good thing a good medication to use. If you're a perfect candidate, I don't recommend using it right before a teenager is going to go to college, like in the next several months, because we need to keep an eye on the patient,
right?
Because there's lots of blood work that needs to be done and lots of questions, including birth control have to be important there. As far as in combination, like over the counters, there's benzoyl peroxide, salicylic acid. There's now over the counter adaptogen or differin gel. In combination with those, we have things that you could do in the office, which are facials, which are great for cleaning, and in addition to using your topicals. And we also have lasers that help with the acne marks. So when I have a patient that has pustules and redness in indented areas or hyperpigmentation, I have a laser that's called an N-light laser. It's a vascular laser. Okay. And it doesn't give you any downtime. We do it every month or so, and it just, after like the fourth treatment, there's like no marks left on the skin.
Right. So that's kind of rebuilding that collagen. So if you have acne pit scars or even taking care of pigmentation, you said
and
as well.
Also the red marks. So a lot of patients will have those little red marks that are left over. They'll after treatment, like first or second month, they don't have any new acne pimples, but they have the marks. And now we're going to work on the marks, and that laser is perfect for that. There's another laser called a BBL, broadband light, which is like a really strong IPL. Yes. But it's more gentle and it's more geared to skin type. It's fabulous for acne as well as marks. And controlling acne rosacea.
Right. So they just need to come have a consultation, because depending on what type of breakout they're getting, inflammatory, non-inflammatory, and what regimen they do, then these are in support of helping that to take care of the skin.
Yes, and we also, in the consultation, would touch on their diet as well as how they're taking care of their lifestyle, keeping the stress down.
Oh, yeah, I love that. A little bit of yoga.
Yeah.
Yoga for acne. I love that. So what do you think are some of the top misconceptions people have about acne, or questions that you people are asking you that they're getting wrong information regarding acne?
So I'll have typically a teenager, they'll go to the counter and before COVID, I guess, but they would go to the makeup counter and they would, and their skin is really oily and they're told to put a moisturizer on.
Right.
I think that's a big mistake that not everybody needs a moisturizer.
Okay.
And they're not going to age just because they're not using a moisturizer. Right. And also picking and having to get rid of every clogged pore is not a good thing either. And overly drying your face and putting tons of retinol or Retin-A every single night is also not great choice to do. You could get the benefits of using it by using it a couple times a week. And then if you... it's also the genetic thing. It's not your fault for getting the acne. A lot of patients will think it's their fault, and it's really not their fault. It's just that they have to understand how to take care of their own face and skin on their body.
Yeah, I think it's just a little bit different for everybody. There can be different causes. Like right now, there's a lot of masks. Still, we're going to be wearing masks, I think, for a little bit now. Are you seeing more inflammation or maskne or breakout underneath those masks? And what are you suggesting for that?
So I feel so bad with everyone having to wear the mask now. I mean, me included. But the acne gets, you're sweating in there, you're breathing into the mask. The mask has either chemicals or detergent on it, and then you're putting that back onto your face, and there's friction rubbing, and it's clogging your pores and causing more of the dead cells and bacteria to build up. But you can't not wear a mask. Correct. So what do? So you have to find masks that are more comfortable for you.
Okay.
And then during the middle of the day, like if the kids are in school, maybe they can wash their face in the midday and then get a new mask to put on. They can put some medications on midday if they're able to do that in school. And I find that the disposable masks can cause allergic reactions more so than just like a regular mask that we have, like cloth masks.
Okay, that's interesting.
Mm-hmm. And then if you put like certain detergents in the mask, like Shout to get the stains out, that chemical, if it stays in there, you're breathing that chemical in and it's going on your skin. So that can also cause an irritant allergic reaction or more irritant acne as well. So maybe like the baby washing powder, remember that? Like draft, really clean and or like
simple.
An all free and clear. I like some of the masks you can just put in the washing machine and put on delicate.
Yes.
It's made of like a material that you can work out in.
Yes.
Those are probably a good choice.
Okay. So more breathable, gentle detergents on there as well.
Yes. I've seen the kids when they would play lacrosse or baseball, and they would have to wear their helmets and masks, and those kids also were getting constant acne. So now that's the same kind of thing when adults now are having to wear a mask day in and day out. They never had acne, and now they don't know what to do with themselves.
Right.
And it's part of an acne rosacea or perioral dermatitis that's actually causing this problem.
Okay, so those are some great tips. I know, too, when I was working in the treatment room, I worked on a lot of African-American people and the oils that we put in our hair or the gels that we use on it. Sometimes those can cause acne. So can we talk a little bit about product like cosmetic acne, like you can get it from blushes or foundation or hair products. So those are things that people should look for.
So if you notice that you're getting more of a bumpy acne around the hairline, it's like what we call pomade acne.
Okay.
And I find that a lot of the leave-in waxes or gels in the hair, and the kids or adults, they don't wash their hair often. And all they need to do is not wash all their hair. If they don't want to wash all their hair, they can just wash maybe a centimeter around the hairline.
Okay.
Dry that, and then be able to cleanse their face and put their medications on. Again, the same thing, less is more. So if you want to put leave-ons in your hair, maybe put it a little bit further away from your face.
Right.
And more on the ends, and be careful of the bottom of the hair if it's long, and don't let it hang on your back. You want to lift your hair up.
Right.
And men have long hair too now, and so
they do.
Yeah, so we're finding that there's men having acne back in their upper back from their hair. And then if you're spraying hairspray or any type of leave-in oil or something, you just want to make sure it doesn't hit your face. And you try to keep your hair off your face as much as you possibly can.
And does that go the same for like touching your face with your hands during the day, or if you have to wear a hat? Can all of those things contribute?
Yeah, so under the hat area can cause that irritation or suffocation of the follicle, as well as when you're touching, like a lot of people will touch the spot on their face to see if it's still there.
Right.
And it is still there.
Right.
If you could look in the mirror to see if it's still there, but if you touch it, it'll get bigger.
Right.
And then it's like when you squeeze a pimple, also you're touching, and you squeeze it, only a quarter comes out and 3/4 can rupture under the skin. So that little tiny, almost invisible bump now comes very visible. And then you're more self-conscious of it. So if we just left our hands off our face from picking, it would help a lot.
I see a lot of stuff on social media with people either putting heat on inflamed blemish or icing it. Do you have any kind of at-home tricks for people if they wanted to go away a little faster besides just leave it alone and let it run its course?
So the heat and ice are okay, but they can also burn if you leave it on too long.
Okay.
Also, some people will take a salicylic acid toner, I've seen it where they've soaked it in a cotton ball and then like left it alone for a long period of time, that actually burn their skin, like a chemical peel. And if you leave it on too long, like I had a patient that left it on her cheek and went to sleep with it, and she had it hole into the fat the next morning. Wow. That's how strong that toner was. Wow. So you have to be careful what you do. But there people talk about toothpaste. An old-fashioned trick I used to use when I was a kid, because I had acne a little bit when I was a child, was milk of magnesia. The magnesium sulfate, which it's not invisible, but we took a little cotton ball and put it on, and we had like little white dots on our face, and by the next day it was all dried up.
It was all dried up.
Yeah.
All right. So all the milk of magnesia is going to be gone off the shelf. After this podcast, they're going to have like a spike. So buy some stock, guys, because they're probably going to have a little spike.
They wonder what's going on.
They're going to wonder what is going on. So is there any way at all to prevent acne for people who are like, I've never had it and I don't want to get it? Is it something that's preventable, or is it just treatable and maintainable?
Well, if you know, like all of a sudden you're noticing you're getting more flushed or red, and you're living in South Florida and it's hot outside, you want the heat can actually aggravate your acne and make your acne get worse or started, as well as certain foods like red wine, chocolate, spicy food.
All the good stuff.
Yeah.
Is what you're saying.
Actually, believe it or not, healthy food too, like spinach, avocado.
Really?
And some melons.
Okay.
And also soy. Yeah. Certain things like that can, like soy sauce, spicy foods, can actually aggravate your acne. And also if you know your family has a propensity to having acne, then usually you have an idea and you're kind of always taking care of it. But cleansing your face twice a day is also very helpful. And if you're in South Florida where it's hot, you might want to wash your face a third time at the end of the day, because if you're outside and you want to get some of that pollution off your face and the oils, like even if you're living in New York too, I mean, it's still the same thing with hot and humid
and pollution, and a lot of pollution. All right, so we did a little social listening, and we asked some of our Image Skincare followers on Instagram some questions. So is it okay if I ask some of the questions that our listeners sent in?
Sure, see if I can help you.
All right. So the first one is, I really love this one. This is a great one. What supplements can people take to help with acne? So is there any vitamin or anything I should be taking?
So there's zinc and selenium are two really good vitamins. It's also helpful for maintaining your immune system. Also, your acne can get worse if your immune system goes down. If you're not feeling so good and all of a sudden you have a big mama pimple there.
Yeah.
And also vitamin C is helpful. And it seems to be all the antioxidants that are good for your immune system are also going to be good for your skin.
All right. And is there a certain amount that they should be taking, or just take it like in the multivitamin is okay?
I start with a multivitamin, and there's some combinations like Airborne.
I love Airborne.
You can put that in a little drink. You don't have to be flying anywhere, which I don't think many people are flying very far. But you can take that, and that seems to be very helpful.
Okay, I love Airborne. All right. So we spoke earlier about you can have acne on different parts of your body, not just your face. Is the body treated the same with acne as you treat on the face?
So it can be. Typically, the chest and the upper back are a little bit more oily than the face.
Okay.
So I'll recommend a retinoid or retin-A type of, or tretinoin, or glycolic acid, a little stronger for the back, or maybe use it a little more often than the face. And everyone has a different T-zone area that they might need a little extra help, and on the sides they don't need as much. So it's kind of more personalized, and I would help the patient if they came in for a consultation what to do in that regard.
All right, so that skin tends to be a little bit more resistant, so you might have to pop it up a notch from what you're doing.
A little bit if you're more oily, yeah. And also be careful of picking those areas too, because they can scar.
All right. So this question is really good. Is there a way that you can control hormonal acne better?
By yourself would be diet.
Okay.
Making sure that your meats and chickens and your milk, or if you're drinking milk, are organic.
Okay.
Your eggs are organic.
Okay.
And lots of plant-based would be good to eat. Lots of water. And then as far as topical hormonals, we have some special made prescribed medications that we do tailor-made to the patient in the office with spironolactone or dapsone. Those are two medications that we use for hormonal acne. And then there's other oral medications where, depending on your blood results, it would be oral spironolactone or metformin, or a type of birth control that will lower the androgens.
Okay. So you really, if you, to really determine that acne is being caused hormonally, you need to see your physician and have some blood work done.
Typically, I like to have a baseline blood work, because if the DHEAS is high and the serum free and total testosterone is high, then we really need to lower that. And then I'm going to need the patient's help with their lowering their own cortisol levels by not being so stressed out, drinking lots of water and yoga and meditation, and not eating sugar. And controlling all the high glycemic food intake.
I love how you're talking about, it's just not a one fix, right? It's not just wash your face or just apply this cream or serum or medicine. You really have to have a whole lifestyle in order to be able to be treating your acne effectively.
Yes, you need to, besides exercise, sweating, and then cleaning the sweat off. That's part of it, because it's helping with the stress. And then what you put into your body is nutritious, is going to help with your skin as well.
Okay. All right. And this is the final question that we had. What are some ways that you can treat the hyperpigmentation and acne scarring? So I know we went into that a little bit. Can you talk a little bit about what that hyperpigmentation is, or why we would get that scarring?
So there's post-inflammatory hyperpigmentation. So after
which I get.
So after inflammation, like if you're cooking, you burn your arm, you have a red mark, and there's a dark mark. Some people's dark marks will go away faster than other people's, and some people need a little assistance. So the same thing goes with picking a pimple on your face or having a leftover inflammatory pimple. If you pick it so far that it's down to an area of white or hypopigmentation, in addition to hyperpigmentation, there's no hope or help for hypopigmentation. Right. So don't pick that.
So deep. Stop picking.
Yeah. And then as far as the hyperpigmentation, we have lighteners with azelaic acid, which are by prescription, or Finacea, which is the brand name. It comes in different formulations, like with gels or foams or lotions or creams. Okay. And depending on if your skin is oily or dry. And then there's hydroquinone, which has is a prescription medication. Depends if you want to diffusely lighten everything or just pinpoint your pigmentation. Those lighten, and the most important thing for pigmentation or lightening pigmentation is sun avoidance. Yes. With a sunblock that has titanium dioxide and zinc oxide. So it's more of a mineral sunblock and not a chemical sunblock.
All right. Okay. I love that. And then what about the scars? How do we prevent or treat those scars?
So there's different kinds of scars. There's ice pick scars. There's more indented, like scooped out scars. Yeah. We have a variety of different things. We have lasers to help with them. The whole thing is to be able to continue your lifestyle, so you're not interrupted and not like healing for 2 months, trying to get rid of 1 or 2 scars. What you want to do is do it gradually, because that's how skin changes. So we have the Enlight or vascular laser I was telling you about that helps with those purple, indented, or hyperpigmented scars that look like purplish and brown. And then that also builds collagen. And it's a slow process, but after several treatments, the patients put makeup on and they're all smooth and they're happy. And some are walking around without makeup, which is great.
Is usually our acne goal, right?
Yes,
To not have to cover everything up with acne. I know at the beginning of my acne journey, when I was learning more about skin, one of the things that really helped me was having chemical peels. Like I had a series of chemical peels. How do you feel about chemical peels to be able to maintain or treat or take care of the skin and acne?
So some chemical peels are, it depends on their skin type. So there's different varieties of types of skin peels with resorcinol or glycolic or salicylic, TCA. You just don't want to do something too aggressive. The first thing first is everyone says, just take off all my skin, doc, and then I get new skin. But then it may look good for 2 weeks, but then after that, you could be hyperpigmented later. Right. So you want to go slow, and you don't want to have a peel. You don't have to be like where your skin's coming off in sheets to have a good result. You can do a light peel where you're molecularly peeling slowly and then improve with other things in addition at home, applications at home. And so it depends on your skin type and how much sun exposure you're going to have, which the peel that you should choose for your skin. I mean, I like peels. We do peels in the office.
I love that you said that. I think one of the biggest misconceptions people have too is that, I've had this condition for a long time, and then I'm going to come into your office and you're going to fix it.
Right. And one
visit, one cream, and we're never going to have to try anything else. So I love that you say be slow, because acne can be, it can be a little nerve-wracking and people want to be more aggressive. So I definitely love that you say be slow, and it's going to take time.
Well, the other thing is today your hormones and everything are the way they are today.
Right.
Tomorrow you could be completely different.
Right.
And then like a couple months from now, who knows? I mean, could have a pandemic or not have a pandemic,
The stress could be big or it could be
perfectly
stress.
fine, right? So you don't know. And so as your body's going to respond to whatever environmental influences are going on.
Right. And that's why you may need to change up your products or your regimen or your treatment program. And I think the most thing is for everybody to be patient and to still have that acne positivity. If you get a couple of breakouts, I love what you said. You are not the pimple.
Right. It's controllable, and it's okay. You are more than that pimple.
Sometimes it's hard. I get there. I look in the mirror and I'm fixated on it. So
you can cover it, and there is a benefit of a mask today.
Oh, that's true.
Yeah, you got to look at the positive with the mask.
Some days I need a ski mask. But
I don't think so.
But as long as we can cover it up. All right. So this was amazing information. I learned so much stuff. I always learn so many things. Now, if someone wanted to come to your office and have a consultation, how do they reach you? How would they get in touch with you?
Well, we have Instagram. You can DM. Okay. It's Miami Dermatology.
Okay.
And our phone number, if you're going to call, we make appointments that way too, is 305-279-SKIN. 7546.
Okay, I like that. And, easy to remember.
And we also have a website, longwillderm.com.
Okay.
Longwillderm.com. And we just reach out, and you can also look me up, Deborah Longwill, Longwill.
All right. So all things acne, I think we covered everything. Is there any little acne nugget that you want to leave our listeners with today?
Just be kind to yourself. You are beautiful, and throw away that mirror, the high-powered mirror.
Especially those magnifying
that magnifying mirror, you got to get rid of it. Brush your teeth and run.
Brush your teeth in the dark.
Yeah.
All right. Well, thank you so much for being with us today, Dr. Longwill. Thank you guys for listening today. And of course, you want to make sure that you tune in every single month. So follow us on social media at Image Skincare. And we are going to see you here next month with
Thank you for listening to Skinfluenced. If you are skincare obsessed just like us, don't forget to subscribe and rate this podcast. We also love hearing from our skincare fans, so send us your questions and comments to skinfluenced@imageskincare.com.